going to do the cardiac assessment. Again, I'm going to demonstrate the pre-assessment. And yes, you can use your sheet. You do it on the mannequin. So first, you're going to come in, and his name is John. So John, do you have any cardiac disease? Do you have any heart trouble? Just a little bit of high blood pressure? Okay. Do you have any chest pain right now? Patient says no. Do you have any shortness of breath? Patient says no. And how many pillows do you sleep on at night? Patient states 1. And again, you can kind of tweak your answers however you'd like. Next, we're going to inspect the neck. So we're going to look for jugular vein distension while the patient is sitting up. So we'll get the patient to sit up a little bit. Have him turn his head to the left. And we're just looking to see if there's any jugular vein distension. I don't see any. Next, since we're here in the neck, we're going to listen to the carotids. And remember, you're going to use the bell of your stethoscope. I always test it first. And remember, you shouldn't hear anything, okay? But we're listening for a bruit. Next, we're going to palpate the carotids. We're going to do both of them, just not at the same time. So we're going to listen or feel. And here we're just going to grade it. Okay, remember our grading scale is a 1+, 2+, or 3+. Then we're going to palpate the apical impulse. Apical impulse is left midclavicular at about the 5th or 6th intercostal space. It's kind of right up underneath or around the nipple. So we're going to go in there and just see if we can palpate the apical impulse. This will be a lot easier when you guys get to do it on each other. Here we're just going to see if we can find it. We're not counting it. This is not a pulse site. Okay. Next we're going to go ahead and listen, and I want you to listen to the 4 valve spots that we talked about in class when we talked about the aortic, the pulmonic, tricuspid, and mitral. I'm going to go ahead and just demo on this guy because you can see the intercostal spaces better. The aortic is the 2nd intercostal space on the right side. So if you come in and look, under the 1st rib is the 1st intercostal space. Under the 2nd is where the aortic is. Then you move across to the 2nd intercostal space on the left, right by the sternal border, and that's pulmonic. You're going to go down to the 4th or 5th intercostal space, right still at the left of the sternal border. That's our tricuspid. And then you're going to move to the 5th intercostal space, left midclavicular line, and that's our mitral. Okay? So then we'll go ahead and we're going to listen. So listen, move across, pulmonic, going down to tricuspid, and then mitral.